Well, good evening. My name is Bob Mason, and I'm the director of the Medical Strategic Network, and want to again welcome you to a webinar for our Whole Person Care Preceptorship alumni. And so thanks for either joining in live with us tonight or watching later. But we appreciate you, appreciate what you're doing, and would love to be able to sit down and visit with you face to face sometime. But since in most cases we're not able to do that, we do these webinars every time to sort of every few weeks to sort of keep in touch with each other. But tonight we're going to be talking about one of the things that's sort of clear in medicine, in medical training. There's this adage that says, see one, do one, teach one. And when you were with us in Redlands, we talked a lot about seeing one. We talked a lot about doing one. In recent years, some of you have had a chance to teach one, but one of Young Chin's original desires was to be able to see healthcare professionals equipped by other healthcare professionals to do whole person care. And so tonight we have two alums who are doing that with us. Alicia Kithcart is a family medicine practitioner down in Houston, is on faculty at Baylor. And Terry McGrath is a family medicine resident in Bryan, Texas. And so both of them are with us. So Terry, welcome.
Thank you.
And Alicia, glad that you're able to be here with us tonight.
Thank you very much.
You're welcome. So Alicia, let me start off with you. When were you first introduced to doing whole person care?
Mm-hmm. So I participated in the Whole Person Care Preceptorship in the summer of 2003. That was between my first and second year of medical school. And I actually found out about the METS program when I was an undergrad, but I wasn't eligible to apply. And I feel like medical evangelism has always been something on my heart. So I felt like it was something that would come along easily, but I needed more training in how to actually do that.
So yeah, I remember coming out. We were excited that you were joining us, and 2003 was a great year. I'm from Mississippi, and I remember I think there were three guys that joined us that year from Mississippi, and that was a sort of a personal highlight for me. But Alicia, so you did the preceptorship, and then you graduated from med school up in Boston, and then where did you do residency at?
So I went to medical school in Boston, and then I did Tufts University Family Medicine Residency Program in Malden, just on the outskirts of Boston. And then after that 3-year residency, I did a 1-year OB fellowship in Chicago.
Oh, wow. Mm-hmm. Like those warmer climates?
I actually met my husband doing a medical rotation in Kenya that kind of solidified my desire to do OB and more high-risk obstetrics. And he said after a year of snow in Chicago, we were done and moving back home to Houston, to the south.
Okay, oh, that's right. You are from Houston, and so you got to go back home, and so you're close to family and everything. Yes. So as you got into Houston, as you rolled into town and you started practicing family medicine with an emphasis on OB. How did that summer of 2003 make a difference in terms of how you practiced medicine and whole person care?
Actually, since I did the program in 2003, now I'm maybe like 13, 14 years removed from it, I found that although I had the knowledge and had the skill set to apply kind of in medical evangelism and spiritual care with patients after addressing their medical needs competently, that I think the rigors or the distractions or just kind of stressors, even positive stressors of life, made it more difficult to do consistently. Getting married, having children, and even my first job after residency, it looked good on paper. The mission statement looked great, ideal, reaching and kind of marginalized, disadvantaged group. But the administrative staff didn't have my best interests in mind. And through my husband and my family, I realized I had burnout 1 year out of residency. And that really, I think I had to come to grips with that and refocus. And that's when I got reconnected with METS to kind of really realize what's my calling, how am I supposed to do that? So I think the rigors of life made it difficult to do well.
Yeah. So and thanks for your honesty. and about that, because and so getting in it maybe once you really started into your practice, you weren't doing some of the things that you had maybe anticipated as a med student or whatever. What was there something that sort of reinvigorated your passion for integrating your faith into your patient care?
Mm-hmm. So throughout the years, I appreciate the newsletters, especially from the summer preceptorship. It reminded me of the connections and networking I made and the other Christians who are passionate about Christ too, and how to share that in their practice. But I think reconnecting with Mets, going to one of the 1.5-day CME workshops in Houston, it was February last year, February 2016, that kind of rekindled that passion, rekindled that flame in a very practical way.
Okay, wow. Why do you think, or how do you think that happened, or, you ended up at that conference? And
other than you emailing me and saying, hey, Lish, are you in town? Are you available? And by the way, could you distribute some of these kind of flyers and cards to publicize? I think hearing some of the personal testimonies, I remember Anna Dupuy, I think still, if she's not married yet, she shared an awesome testimony of one of her medical mission trips. It was in like Southeast Asia, maybe Thailand or somewhere, but she was, God had convicted her in her prayer and kind of fasting time that day that no matter who comes to her in her line, she needs to pray, offer to pray with everyone, offer spiritual care to everyone. And we were talking about ethics, kind of like the justice. If you know something's good, you need to offer it to all. And it was in a community where there were predominantly there were monks who were witnessing what she was doing. So at the end of a long day, just offering to pray and do spiritual care with everyone, one of the monks came in her line specifically, and he asked to receive Christ. And this is in one of those kind of closed towns or countries where people may not know Jesus. And these are the spiritual leaders, kind of gurus. And that was just really convicting, because the Holy Spirit convicts to draw us closer to Christ, right? It's the enemy who condemns and puts a barrier between us and God. And I thought that was just a sweet kind of admonition that we're supposed to do spiritual care regularly, consistently, with most people. Obviously, if someone's in a coma, there's something emergent, we can't do that. But on a regular basis, share Christ with people who are willing and interested.
Yeah, I remember you sharing with me that there was something also in your own life, sort of your personal life, even before you came to this conference in Houston. I think it was about a year and a half ago. That I remember you telling me it's sort of you feel like it's sort of set you up to move into a new place in terms of living out your faith.
I'm not sure maybe specifically what that is, but I feel like the jumpstart of February 2016 was that I started trying to share whole person care on not only an individual level, like a provider-patient relationship, but work with some of the chaplains at the major hospital where I work at to disseminate this knowledge at a Grand Round surgery, where now they're actually doing a study, going through IRB to get permission to go through similar spiritual history that we do, but they call it the HOPE, go through HOPE questions. I've gotten to speak at Baylor College of Medicine. It's actually, I guess, an elective course that many of the students participate in, but sharing about whole person care and what spirituality is. And now I'm actually going on a mission trip to Laredo, Texas this weekend. So keep that in your thoughts and prayers with UT, McGovern Medical School. It's not a faith-based trip, but at least it's a trip where medical students are trying to reach out to the underserved, the homeless, and hopefully spark a conversation. What is whole person care? What's your experience in taking a spiritual history? Do you get education on this? And what I found in kind of my informal survey is that most people don't get adequate training. It's, hey, it's a checkbox. It's not something that's meaningful or intentional or relative to people's lives to help in their health and healing.
Wow. And Terry, when was it you did the preceptorship and came out and joined us in Redlands?
I did the preceptorship the summer of 2011. It was the summer before I started medical school.
Wow.
As an
Go ahead.
introduction to any pre-medical students or people that know pre-medical students, that's a great time to do the preceptorship. And I would encourage thinking about that. But sorry that.
No, that's good. I think probably with med students, probably about 45, 48% of them come the summer before they start medical school, and the other, most of them come the summer, or the balance comes the summer after. We're beginning to see more and more students come between third and fourth year, sort of do it as an elective rotation. But as I recall, Terry, you didn't come out to Redlands by yourself, did you?
No, I brought my wife Maggie. We were like 3 weeks married.
Sorry. Praise God.
And it was great.
Yeah.
It helped unite us, like kind of in this part of our life mission, because it's something that I can't do without her, because it takes up time and effort, important time and effort. But if we weren't together on it, then it would be really difficult to do. So it was great. And I think she got a lot out of it as well.
Yeah. So that whole experience sort of helped you guys get on the same page in terms of how you wanted to practice medicine, or some of the things you wanted to involve when you practice medicine. And then also have her understand that and be maybe even more supportive of what God called you to do.
Absolutely. And I think she got it. I mean, just to be around so many Christians and have that time for discipleship, she got a lot out of it personally, but I wouldn't have wanted to do it without her. It was so important for me, and I just wouldn't want to go through all that spiritual growth separate from this important person in my life. So,
wow.
Yeah, I would encourage other people to think about doing that as well.
What were some of the things that have remained on your heart and in your mind since that summer of 2011?
I think the thing that was really transformational for me during that time was just a solid foundation of thinking that what we do as healthcare professionals, as physicians, as nurses, to take care of patients as Christians, is about the patient, and not about a feeling of doing your duty as a Christian. That our work is centered on caring for people well, loving them with the best love we have, which is through Jesus, and trying to offer them whatever they're ready for, and really giving them a personalized prayer and encouragement and hope, rather than a physician-centered or a Christian-centered approach, which is of wanting to feel good that I did something. And so that was from the start what I think the preceptorship convinced me of, and that's what I've carried forward.
Cool. And what have you done to pass on what you learned in Redlands to other people?
There's been my two initiatives, I guess maybe could be, there's been a lot of little things here or there, and it's a lot less official than maybe I can make it sound. But in medical school, I found one preceptor, a family medicine attending, who was interested in spiritual care. And honestly, at this point, I don't remember how I did it, other than you just start talking to people about wanting to do spiritual care, and you find people that are interested, and you find people that are a little bit interested, and they'll often say, hey, you should go talk to this other person. I know they're more interested than I am. And so you start to, by throwing out feelers and talking about wanting to do it, you find there are people in your community that maybe they don't have the METS training, but they have an interest. They have some kind of desire to do this, and so that's how you start to gather people together, and just people that you know are trying to follow Jesus and are in your class. That's a big part that I start. So I found this preceptor, and they set it up where we could come to their hospital and talk to patients on their family medicine service. And so then I gathered a few people, and we did it pretty much. We didn't reinvent the wheel. We did it just like we did at the preceptorship, and we said all the same things. And we probably met 3 or 4 times in my second year. And I envisioned it to be this monthly thing where lots of people came out every time, and it didn't just instantly become that big of a thing. And probably, as I look back on it, maybe a total of 6 students were directly affected by this. But still, and then there's one guy who went to the preceptorship afterwards. And that's one of the take-home lessons I think I have from this, is just that, just like the numbers isn't necessarily something that I hang my hat on in terms of doing this, but just doing something and trying to be faithful with the time you have. And I think there will be lots of ripples and kind of results that I can't see from that. But I think principles of just talking about it, finding other people who are interested, and doing something with that training about it is what I learned from that.
Wow. Yeah. And thanks for sharing that. I can really resonate with what you're saying on a couple of things. One is in terms of the numbers. I thought about this and even talked about it for a long time. I mean, at the end of Jesus's ministry, I don't think he had hugely impressive numbers, but he understood this whole idea of multiplication. And is I've sometimes talked about with some of you, we are all direct spiritual descendants of the original disciples. And it was because Jesus poured into them, and they poured into others who multiplied and taught others. And so I think what you two are talking about in terms of sharing your vision and sharing some of the things that you've learned with others can make a huge difference. Just this week, or last week, I was walking through the halls at the med school. There was this big meeting going on, and there were these different organizations and vendors and everything exhibiting. And there was a guy there representing a hospital and maybe recruiting for their one of their residency programs. And I started talking to this guy, and I didn't know him. And he said, "Now, who are you and what do you do?" And I told him, and he had gone to med school there. And he said, "Oh, I remember you guys, and you're the ones who did that training on whole person care on Friday afternoons." And I'm like, "Yeah." And I look at this guy again, and I can't remember him from anybody. I don't recognize his face. I look at his name tag. I don't recognize his name. And then he said, "Yeah, that had a huge impact on me." And so I'm sort of thinking he's talking about somebody else. And then he says, and it's really helped me in terms of how I work with patients. It's helped me in terms of interacting with them and praying with them. And then he said something that it was like, "Okay, that's us." He said, in the phrasing that you guys use, he said that whole thing about asking them, would it be helpful? And of course, if you've been to a METS conference, if you had a chance to meet Young Chen or Harvey Elder or Stan Shu or others, that's just sort of, in some ways our tagline. And when he said, "You guys taught me that phrase, would it be helpful?" And I asked my patients, "Would it be helpful if I pray for you? Would it be helpful?" So and so. And so you never know how us being faithful to pass that on to others could make a huge difference. Alicia and Terry, I want to come back to you and ask you this question. As you have been doing or been trying to stay true to the see one, do one, teach one, and passing that on to others, in being mindful of that, in lecturing or doing that when students are rounding with you, as you've been training others, Alicia, do you feel like what, if any, effect has that had on you continuing to practice whole person care when nobody else is around?
Mm-hmm. I think if you had to sum it up, accountability. But whenever I'm teaching, like I teach medical students regularly, and one of my coworkers has a daughter who's pre-med, and she wanted to shadow some people during her winter break, so I work with her. But I always try to come from a humble attitude. Medicine's always changing. We're always learning. So I try to say it's a two-way street. Oftentimes we have to critique or evaluate students after they rotate with us. And I go, please evaluate me too. I can only become a better teacher if you tell me it was helpful. We're different learners. Some people are auditory, some people are visual, some people are kinesthetic. I'm like, the same thing with medicine, the same thing with spiritual care. What was helpful to you? And people have written cards, people have sent me emails, and it's been really, it's impacted me to do even better what I'm doing. And also, and these people, I don't even know what their faith background is necessarily. It's not going to change how I deliver care, but being sensitive and respectful. And one person said they did religious studies in undergrad, and they really appreciated the humanity of medicine, or doing holistic medicine. And I know holistic can be many different things, but she understood my heart. And it was really interesting what one of the first year medical students who has yet to go through clinicals said. He said, you first deliver good medical care, and you let the patient know that you're their doctor first, but they also know that you care for them as a whole person and their family, and that you realize that they're a bigger part of a picture of a community. So that there's, I'm sorry if I'm not answering your question, but he helped me understand something I didn't understand about myself. Like, he showed that there's definitely a patient-doctor relationship, but I can hug my patients, I can love them, I can cry with them without taking the attention away from them. And that there's not, like I think Terry said before, there's not this agenda, like we're on a crusade, but the patient is really the center of our attention. We're trying to be relational and intentional, meaningful, and bringing Christ to that. I think Christ exemplifies that. I mean, how can you share the Bible and truth with people if you're not gracious to their need when they're hurting? We're physical and spiritual and emotional, relational people, and he related in all aspects of that. And I think I don't know if it's a bird's eye view, but seeing other people's perspective helps me to continue to be passionate and accountable what I do. And I let them know, hey, I have my good days, my bad days, my days where I'm rushed or just not feeling it, but I really try, you know. And it also helps show my humanity, where I can ask forgiveness and say, hi, I'm sorry, you know, where I'm impatient. I'm like, okay, get to the point, you know, hey, I'm sorry. So I don't know if that answered your question, but it's helped me be intentional. And I just want to echo what Terry said. I think it's critical that we surround ourselves with people who are like-minded. So my husband and I, at the beginning of each year, it's not really a New Year's resolution, but we try to be intentional each year, praying about specific things. And just lifestyle evangelism. I feel like medical evangelism is lifestyle evangelism, meeting people where they are in relationships. And it happens to be medicine. For my husband, it's networking. For someone else, maybe business. But it's keeping an ear open to God and surrounding yourself with like-minded people, sparking conversations, see, hey, how do you do this? How do you share Christ in a real and pertinent way where you are? Because people aren't necessarily coming to the church. Some people are just offended and put off with organized religion, but we can reach people that pastors and priests and vocational ministers can't reach. So it's really an awesome gift. It's an awesome gift that we have every opportunity to share Christ with people.
Wow, thank you. Terry, how about you? How do you think the things that you've done to train other people, how do you think that, how, if at all, does it affect you in terms of how you go about doing whole person care when you're not training people or nobody else is around but the patient?
You know, I don't know if I don't think I could do whole person care, at least for a long time, or even a very short time, without also trying to train people how to do it. Because I just think about what Christ's vision for the church is. He knew we were relational people. He knew that we were not very good on our own, and so he basically requires us to gather and have community. And so I think in training, in trying to train people, a lot of what I've tried to do is build a community around myself, so that I could continue to do it myself. Um, and so I don't think I could do spiritual care sustainably without other people around me, which is why I think we, as the Medical Strategic Network, as a nationwide community, have to gather like this or in person regularly to help keep each other accountable to the work that God's called us to. And I think training people locally gives you that community as well.
Yeah. Well said. Well, Alicia and Terry, thank you for taking part of your evening and joining us. And thanks for the way that you're being faithful to what God's been entrusted to you. As always, we want to thank Kyle Stelzer, registered nurse and preceptorship alum in Missouri, for sort of producing and doing everything for the webinar in the background. So with that, we're going to say goodnight, and God bless you. We are available to serve you. Keep in touch with us, reach out to us, connect with us, because we want to be available to walk with you as you continue on walking with Jesus. So good night.